That's Parker Schmidt. He may not look like it, but he is suffering from a mysterious, insidious, and potentially deadly illness.
It's been a ride. Just really thankful that I'm still able to be here with my beautiful wife and 2 kids and stuff.
In June of 2015, Schmidt had surgery at the Mazankowski, Alberta Heart Institute to fix a congenitally defective heart valve. The procedure was a success, but just over a year later, things started to go wrong.
I was starting to get some night sweats and muscle aches.
Doctors suspected an infection, but nothing showed up in blood tests. He underwent a second emergency heart surgery. That is when doctors finally found the problem. Schmidt's heart tissue was being attacked by a mycobacterium called M. chimera.
It's an incredibly serious infection, and it can be incredibly difficult to treat and to cure.
M. chimera occurs naturally all around us, in soil, in water, but it is incredibly rare for it to infect humans because it needs a way inside the body. In Parker Schmidt's case, it found one during his first heart operation.
So there's a particular machine that is used in the operating theaters for cardiopulmonary bypass.
It's called a heater-cooler unit. They're used to regulate the temperature of fluids during open heart surgeries. During the manufacturing and testing process, the units became contaminated with M. chimera. You can see some of the biofilm buildup in photo evidence from a U.S. class action. The heater-cooler units don't come in contact with the patient during surgery, but on the back of the device, there's a fan.
And so that mycobacteria was then aerosolized by the fan, and basically the fan then blew this air, throughout the operating theater, and basically landed kind of in the open chest of a patient.
Put my legs up.
Yeah, scooch back a little bit.
Paul Johnson had his heart surgery in October of 2015. M. chimera spread into his bloodstream, his spleen, his brain, and his spine. He's had a second heart surgery, multiple spinal surgeries, but the infection is still there.
Feel good?
If I've woken up and I can't seem to curb the pain, then it's emotionally hard. And, Kathy has to put up with a lot.
This one.
For Johnson, it's now a daily cocktail of antibiotics and narcotics and questions. So many questions.
Just feels like somebody should have known that.
Oh, somebody did know.
The heater-cooler units were made in Germany by a company now called LivaNova. In January of 2014, a Swiss study found LivaNova's devices were contaminated with M. chimera, that it was released into the air during surgery, and that it infected patients. But LivaNova didn't warn hospitals or healthcare regulators until 6 months later. It took another year after that before the company issued a safety notice, and it blamed users of the machines for not following its maintenance and disinfection procedures properly. Margaret Waddell is counsel for a Canadian class action lawsuit against LivaNova.
They breached their duty to warn by underplaying the risks of harms by saying, you're not cleaning the machines properly, it's not us, it's you.
When they found out about the possibility of infection, many hospitals and health regions asked for information and guidance from Health Canada. Some said they were having trouble finding labs to test for M. chimera. Internal Health Canada emails and documents show a level of frustration from healthcare providers who felt they weren't getting the answers they needed. Alberta Health Services wrote, "We are left to decide what to tell patients, future and past, and are struggling with how to proceed. This issue has real potential for placing Albertans and all Canadians at serious risk."
Health Canada, certainly in this case, was not proactive in the same way that the FDA was.
As early as October 2015, U.S. regulators said LivaNova devices should be removed from service if they showed signs of bacterial growth. FDA inspectors found violations in LivaNova's cleaning and disinfection procedures at its manufacturing facility in Germany. By June 2016, the FDA confirmed the link between the infections and LivaNova's machines and said patients should be informed of the possibility of infection. During this entire time, the only information available on Health Canada's website was the original notice sent out by LivaNova.
It did kind of set off some alarm bells, and really, when we went to Health Canada to try to figure out exactly what the issues were, we really didn't get a lot of answers.
In a statement, Health Canada said directing health regions to the manufacturer was necessary to ensure that the manufacturer could investigate customers' concerns and support them in resolving contamination issues. LivaNova said it has implemented a device remediation plan to further mitigate the already low risk of contamination. The chances of being infected are rare, between 0.1 and 1% of patients who've undergone open heart surgery. That would put the possible number of people infected in Canada at between 80 and 800.
It was absolutely tragic for me. This was my soulmate.
Sheila Hagen-Bloxam's husband, John, had surgery in Edmonton in 2016. The infection spread into his bone marrow. 2 years later, he died.
I am very angry. John was not a person who had a vengeful bone in his body. He would not like the idea of being involved in a lawsuit. But he would be adamant that he did not want this to happen to anybody else.
Of the 10 people in Alberta known to have been infected with M. chimera through heart surgery, 8 have died. Paul Johnson and Parker Schmidt are the only 2 still alive. Both have joined the class action.
We're not wanting the world or anything like that. I can't get approved for life insurance, and no insurance company will touch me with a 10-foot pole. If I were to die tomorrow, Jill's not left with anything really, and our kids aren't left with nothing.
The last of the contaminated LivaNova machines in Canada was taken out of service 4 years ago, but it can take 5 years for symptoms to appear. So there may be others out there like Parker Schmidt living with this infection. They just don't know it yet. Aaron Saltzman, CBC News, near Barhead, Alberta.